Nwokolo. I'm a mother of three lovely girls, and the middle one, who I call N2. She's the one that's got autism, and I developed interest in the field because of her. And so today, in honor of GTB's program on autism awareness and the lovely work that they've been doing to try and get the society, the population, and everybody more aware of not just what the disorder is about, but their access to resources in terms of either the professionals or training or wherever they can find help, linking the community together. I'll be talking about training, access to training. The reason I want to focus on training, just very briefly, comes from the fact that, like I said, my daughter, she's 19, we've been on the journey for as long as she's been alive, but in the last 16 years of her life, she's had interventions, both here at home in Nigeria and just a few stints outside the country. And so I was able to see the difference between what I got outside and what obtained in country. And I was able to pin that down to the training and the level of professionalism that we had in the country. So I retired from my 9-to-5 job. That's every month end there would be win in my account and went into this area. So what we're currently doing, apart from the intervention of one-to-one for children, is also training our professionals. So we train them to become behavioral technicians, registered behavioral technicians after they take and pass the board exam, or they become applied behavior analysis technicians. That's another credential they can get from the QAB, a different credentialing body. And these exams can be taken from the comfort of your home. Again, training is also important for parents. Okay, so there's a parent training, and the reason I say parents need to be trained as well is that it better equips them to understand the service that they're receiving. It helps them question what they are getting. It helps them satisfy or derive some kind of satisfaction in knowing that whoever is working with their ward, with their child, knows what they're doing. So for instance, the same training we give to people who want to become behavioral technicians is the same training that I would give to parents. I do insist. The reason being that parents play a major role. Okay, so even if you had a technician or somebody like myself that's a board certified behavior analyst coming to work with your child for 8 hours a day, you've got 16 hours left, right? Who's going to take care of the child? It would be you. So I feel that parents need to understand what to do and how to work with their children properly to avoid frustrations. And so if they get the same quality and the same level of training that the behavioral technicians receive, it puts them in better stead to work with their kids. So they have become proficient in data gathering. For instance, they know what to do, what we call maybe like antecedent interventions, and a whole lot of other skills that they would acquire. And like I said, they're better equipped to decipher between somebody who knows what they're doing and the person who doesn't. So if the individual comes to you and says they're a behavioral technician or they're a therapist or whatever it is, and 6 months or so into working with your child, for instance, and you're not seeing noticeable changes or socially significant behaviors or skills being acquired by your child, you should be able to ask questions and then address those gaps if the parent is trained. On the professional side, I know there's been a lot of stuff that's been offered in the country, and it's time we move to the next level. There's no point still beating about the bush with mediocrity. We need to equip people to understand the science behind what they're doing, to understand that working with this population is akin to administering medication to them. And so when they don't use the proper techniques, they could actually end up doing more harm to the kids rather than doing them good and moving them forward. So that's why we're now in that space offering that training to get them properly equipped. And it's all about the science of applied behavior analysis. I know people have heard ABA, and they're thinking, oh, ABA is like taking paracetamol for a headache. No, it's not. And so when we do trainings, we demystify that whole concept of ABA being a quick fix, or it's just a solution to disabilities, especially in the space of autism. So you may hear people saying, oh, just go do ABA therapy. And I'm like, hold it, guys. It's not about ABA therapy. It's about using the science. So those are the areas that we address in the space of training. One other thing I would like to mention and point out is the area of assessment and diagnosis. It's important to differentiate between diagnosis, assessments, or screening, because these are areas that would help guide, as much as we don't like to have a label, but I feel it's important for parents and for everybody to know what they're dealing with. So it's not sufficient of its own to say, oh, I'm trained. Yes, we get trained, acquire the skills to be able to work with a specific population. However, we want to be sure of what the individual has before we start the intervention. Okay, so screening. There are many tools out there that can be used to screen, and these are either level 1 or level 2 screening tools. What screening does is parents or individuals are asked a couple of questions to determine the likelihood of that individual having, in this instance, autism. Okay? Now, the reason we go beyond screening to the next level, which is diagnosis, is because ASD, the autism spectrum disorder, like the name implies, spectrum, people go from 0 to 10, for instance. And as well, people that have ASD could present with similar disabilities. Okay, the symptoms or the traits may appear similar because autism and, for instance, intellectual disability are both neurodevelopmental disabilities. You could have somebody who's presenting with challenging behavior, or they may have fragile X, or they may have Willy Prader, and they have symptoms that mimic or are similar to ASD symptoms. For instance, you may have people who are on the spectrum who engage in self-injurious behavior. You have people who have Willy Prader or any of these other developmental disabilities who also engage in SIB. So the only way to be sure of what that child has or that individual has is to go the next step and get a diagnosis. My simple analogy usually is with malaria. Okay, so there's nothing called fever. A spike in body temperature is just an indication that something is going on. What do? We go to the hospital, right? And then they draw blood and run blood work. From the results of the blood test, your doctor is able to say to you either you have malaria or you have, in this instance now, we have either COVID or you have yellow fever or whatever, typhoid, or they're able to say specifically what is wrong. And that then drives the prescription, the kind of medication you get. So fit it back into autism in this instance. By the time they screen, whoever is out here screens your child, it isn't sufficient to say somebody has autism because they've been screened. You have to get a diagnosis, okay? And that's something else that people kick against because they are afraid of labels. But I say it's important to know exactly what is going on with your ward so that you know exactly what sort of intervention you should be getting. If you come to me, for instance, and you say you have a diagnosis, I would love to know where the diagnosis was given and what tool. There are a couple of gold standard tools out there, at least two that I know of, that will be useful in diagnosing and pinpointing autism specifically. And so I would also want to encourage people, families, to go the extra mile. Get a diagnosis. There's nothing wrong with getting a diagnosis. Like I said, my daughter, who is now 19, living on her own, just got her diagnosis last year, a formal diagnosis, and that's because she was moving on to the next level in her life where she wasn't going to be able to access the support that she required without having that diagnosis. And what the diagnosis helped to do as well was formulate the kind of support that she would need in the environment that she was going into. So I also encourage us to please, please, please get that diagnosis. So two things: train to get effective intervention, diagnosis to know what you're intervening for. So hopefully with these few nuggets or little insights, you would want to get in touch with GTB or whoever is out there or myself, and we can then begin to talk and think about how to move ourselves forward within this space. Thank you.